Alzheimer's is what we commonly think of as dementia, but actually there are many types of dementia, and it tends to be called a mixed type. There's an estimated 30 to 40% that have some sort of dementia, but more often other disorders are mixed in. Dementia is the loss of core brain function that impacts everyday life. It impacts memory, language, attention, and executive reasoning, as well as visual processing. Primary disorders that we typically see are Alzheimer's, cardiovascular dementia, Lewy body, frontal lobe dementia, frontotemporal dementias. Thinking problems that typically occur with Alzheimer's dementia. Memory loss is severe in the beginning stages. Misplaced objects, cannot find anything or remember where it was. No recall of conversations, cannot learn and retain new learning. The memory loss of the past actually remains intact. Visual spatial functioning is immediately affected, getting lost in familiar places like the grocery store, and word retrieval occurs. Cardiovascular dementia. There's memory confusion, difficulty learning and retaining new information. Black and white thinking, becoming very rigid. Getting stuck on one thing or one event. Difficulty with any step-by-step instruction. Problems planning, organizing, or making decisions. And emotional reactivity is present, as well as impulsivity. Symptoms of Lewy body dementia. Planning and problem solving. Distorted visual perception that may affect balance and driving. Thinking is not logical. Don't process things in reality. There's a misperception of conversations, and a mental illness or frank psychosis is seen immediately in the form of hallucinations and delusions. What are the signs of frontal lobe dementia? Problem solving, decision making, flexible thinking. There could be apraxia, skilled movement problems, or aphasia, difficulty speaking and receiving language. There's emotions, as social misperceptions, a lack of emotions, or a loss of insight. Symptoms appear in the 50s and result in poor financial judgment with significant consequences. Frontotemporal disorders are brain diseases that affect the frontal and temporal lobes. Behavior and personality changes occur. Out of character, inappropriate behavior, stealing, and sexuality. Primary progressive aphasia is speaking and receiving language as well as word-finding problems. Or there could be Pick's disease, where you see psychiatric and behavioral abnormalities. Dementia can be the result of many issues and neurological disorders. Multi-infarct dementia is the result of small strokes. Huntington's chorea can result in dementia, impacting psychiatric and frontal processes. Traumatic brain injury and concussion can result in dementia, and what we call CTE, chronic traumatic encephalopathy. Anoxia, hypoxia, the loss of oxygen can result in confusion, personality changes, hallucinations, delusions, and this occurs in the aged with lengthy surgeries. Parkinson's disease can result in dementia affecting memory, language, social judgment, and reasoning. What are the risk factors for dementia? Age, alcohol use, arteriosclerosis, diabetes, Down syndrome, genetics, hypertension, mental illness, smoking, sleep apnea, chronic insomnia, physical inactivity, and obesity. If you know someone or think you have memory problems, don't wait. Reach out to the primary care for help to begin the process of testing and evaluation. People hide memory problems. They're afraid of dementia. They don't know that we can make a difference, especially if we catch the problem early. While there are some dementias that decline no matter what, they are actually a small percentage.